This is CNS infection number 3, prepared by Prof. Sharaf and revised by Prof. Rami Edward. We will deal with some of the virus infection of the brain. In congenital cytomegalovirus, the main feature is the periventricular calcification. Viral encephalitis may be due to herpes type 1 and type 2 or varicella zoster. In herpes simplex type 1, this affects the older infants and children and affects adults, while type 2 is a neonatal type. Varicella is a reactivated due to reactivated viral infection, could be acute cerebral ataxia, could result in delayed focal neurological deficits. So the main viral infections we have here are herpes simplex and varicella, and in herpes simplex we have type 1 and type 2. We'll start with herpes simplex type 2 because this affects neonates. It is exposure to maternal genital lesions at birth, affects the brain in 30% of the infected infants, and symptoms appear 2 to 4 weeks after delivery. The virus destroys the brain and leads to severe neurological deficits or death. CT and MRI shows widespread, rapidly progressive patchy white matter abnormality, linear enhancement, loss of brain parenchyma, atrophy, encephalomalacia. So herpes simplex type 2 is very dangerous and occur in 30% affects the brain in 30% of infants. It is due to exposure to maternal genital infection. Herpes encephalitis of the neonatal type 2 will result in the typical appearance of what we call cystic encephalomyelitis, where the brain is destroyed and converted into multiple cystic changes, which soon shrink and is replaced by CSF. Here it is an appearance of infected brain seen as hyperintense in the T2, while in late study there is cystic encephalomalacia here in the early, and here is the late cystic encephalomalacia with, of course, hydrocephalic changes, and this will result in shrinkage of the frontal and parietotemporal regions. Number 1, type 1, occur in older infants and children. It results in necrotizing meningoencephalitis. If it happened pure perineural spread along nerve 5, there is predilection to limbic system. It spares the lentiform nucleus. It is usually affecting the temporal and the insula. May be normal in early study, may be better than CT. MRI is better than CT. It shows gyral swelling and the edema. Laminar cortical hemorrhage may occur, and the temporal lobe, of course, being swollen will result in mass effect, and we have patchy gyral enhancement. Late we'll have atrophy and gliomas. So this is the appearance of the what we called the hippocampus involvement in herpes simplex type 1 encephalitis. It could be symmetrical, could be asymmetric, but it always affects the temporal lobes, which result in gyral swelling and gyral enhancement if you give contrast. Diffuse types are always seen, and we have here definite meningeal involvement, meningeal hyperemia with enhancement. Now come to the varicella zoster encephalitis or the chicken pox. The majority are under 10 years. It is a reactivated viral infection, and don't forget that there is acute cerebellar ataxia and angiitis with infarcts. These are the temporal lobes in varicella, herpes zoster, temporal lobes involvement, cord involvement, infarcted cord, transverse myelitis, patches of involvement of the basal ganglia, and angiitis. Angiitis, you can see with difficulty that some of the terminal branches are attenuated. Terminal branches are some attenuated, especially on the right side here and anteriorly, and as well as the left posterior cerebral. Here is the diffuse gyral swelling, and edema seen in herpes zoster or chicken pox, and here is diffuse meningeal enhancement. This is another example of neonatal herpes, where we get the cystic encephalitis similar to type 1 herpes simplex. With cystic encephalomalacia. This is the latest stage of encephalitis. Now we have what is called West Nile encephalitis. West Nile encephalitis is bilateral thalamic. We have minimal restriction, but it is resulting in hyperflare, marked edema, and there is no enhancement in T1 weighted images. This is Haemophilus influenza meningitis, resulting in again obstruction of the exit foramina with communicating hydrocephalus and subcortical collection. Haemophilus influenza meningitis. So influenza meningitis can result in subdural collections, can result in ventriculitis, can result in hydrocephalus, and can result in diffuse patchy infarcts. Thank you.